Okay, we're live. Tell us your name.
I'm Linda Deramo.
And what qualifications do you have?
I am a family medicine doctor. I am a certified functional medicine doctor through the Institute for Functional Medicine, and I've been practicing functional medicine for at least 10 years now. It's alternative, it's different, we look for the root cause of things, and we typically don't believe in vaccines. So that was my beginning, my road to where I am now. In 2021, I was working part-time at the VA, seeing patients there, and that was the height of, the beginning of the vaccines. And I saw a patient who had been vaccinated, and he shared his vaccine with me, and I became very, very ill. So I ended
What do you mean he shared his vaccine?
So he was sick, and he had the vaccine, one of the COVID vaccines, or shots, if you will, and I was asked to examine him, but we weren't seeing sick patients at the clinic at the time. So how he got in, I do not know, except he got in, and then I was evaluating him and treated him. I knew he had COVID. It was classic symptoms of the COVID virus. And then 2 weeks later, I was very, very ill. Ended up in the hospital with pericarditis and COVID lung, and given remdesivir. When I asked the doctor for ivermectin, she said, may I be candid, we don't use that shit here. I said, well, okay, fine. So I survived the remdesivir, thank God, and then immediately got home and looked up Dr. Corey's protocol for myself because I was still very sick. Put myself on ivermectin, and within 2 days I was much, much better. So I thought about that and prayed about it, and I said, what am I to do, Lord? And he said, treat, because ivermectin works. So I've been doing that since 2021, treating patients who have the shot and who have been sickened by COVID, and it's been a mission. The conventional medical world has changed so much since I started practicing medicine, and I am a non-traditional practitioner. I was older when I went to med school. I graduated med school at 50 and then started practicing, and when I started with functional medicine, I saw that the medications weren't working, but the functional medicine medications were working. So I thought, well, this is not medication. This is lifestyle change. This is eating properly. This is living properly. This is staying away from the poisons that they're all trying to give us. So in 2013, clearly seeing the handwriting on the wall, I started my practice and have been doing that since then. So today I'm thrilled to sponsor this bus on our parking lot on Polly's birthday. So happy birthday, Polly.
Thank you very much, and we're so grateful to you for housing the Children's Health Defence bus here today.
It's such a privilege, such a privilege.
One thing I've noticed about the people in your area is they're very outspoken. They don't mince their words here, do they?
No, they don't.
They've been a wonderful people to interview.
Yeah.
So, a couple of questions for you. So you trained as a white coat doctor, basically. But what made you decide that you were going to go into the more holistic approach rather than
It was always
the white
an
coat?
interest.
Mm-hmm.
I had listened to a couple of pharmacists on the radio who were talking about the medications not working and not being good for you, and I thought, well, that's interesting. If pharmacists are saying this, how is this so? And I'd always been interested in medicine. So when I graduated from medical school, I thought, these guys are crazy, until I started learning, and then I could see the difference. And so it was a stark difference, where diabetics were able to give up their medications because they changed their lifestyle. And that's not what the focus of conventional medicine is. And I learned that very quickly as well. I was asked to sit on a committee called the Quality Committee. And the Quality Committee was tied to what the insurance companies said the quality measure should be. And so we would be chasing these crazy things like smoking, or the get up and go test. When you're elderly, they do a test for elderly patients to see if they can stand up without using the arms on the chairs, and then without stopping and moving forward. And that was a quality measure, but it was a very small population, so it didn't really cover a lot. And then they would say, if you can gather this information, the insurance companies would say this, if you can gather this information, we'll give you X number of dollars. So we were all scrambling to get this information collected, this data collected. And then they would always change, they'd move the carrot away from us, well, we've changed the measure and now you only have 2 months to get this done. So needless to say, we never ended up getting the money. And finally, after 2 years on this committee, I said, when do we start taking care of patients? And they looked at me like I had 3 heads and said, this is taking care of patients. And I disagreed. That is not taking care of patients. We weren't listening to patients. We weren't giving them the time they needed. We were just saying, take this medication and you will be just fine. Thank you very much. And so practicing functional medicine, I get to learn the whole story of the patient. And that is gratifying to see how they improve.
I have a couple of questions for you. You talked about treating someone who'd had the COVID shot and then you got sick. Do you believe that shedding is real?
I do believe shedding is real. I know that's how I got it. There was no other way. No other way. I have never been that sick in my entire life. Never. And I thought, well, maybe I have pneumonia. I have a little chest pain. And I was out of it completely.
How would you recommend, and nobody's giving out medical advice, Children's Health Defence do not do it, and nor are you right now, but how would you, what would you suggest to do if you're around someone that's been vaccinated, suddenly you don't feel very well? What would be the first thing that you would suggest to do if you were talking to your daughter or something?
So if I was talking to my doctor, well, I don't have
daughter,
a doctor, but
daughter. I'm just trying to make it so that
okay.
it's a family thing.
So I would say if they felt they were around somebody and they were not feeling well, to rinse with iodine and water, or hydrogen peroxide and water mixture, cleanse their nasal passages, gargle with it. I would suggest some vitamins that support the immune system. I would suggest having on hand all of these things that you might need, being prepared. Even ivermectin, being prepared with ivermectin and even hydroxychloroquine, and seeking good advice from somebody who's willing to listen to them. Make sure they're being heard. And if they're not being heard, keep asking. Keep going to different doctors or information.
I'm a little concerned on our journey so far on this bus about the hospital protocol deaths. Not a little concerned, extremely concerned. How do we, which makes me absolutely petrified for anyone that I know and love to go anywhere near a hospital. How do we know when we do need help and when we can actually, because there's that fear, panic thing, isn't there?
It is.
If I can't breathe, am I panicking? I don't know what's happening. I'm watching Fauci talking nonsense, all that kind of stuff. Can't breathe. I'm going to die. I'm going to go to the ER. Seems to me like a lot of people, yes, they were sick, but there was also an element of panic.
A huge element of panic, because that's what was fomented. That's what was spread, was fear. Somebody just gave me a card that says fear is a liar. Mm-hmm. So I think take a step back, take a breath, get some good counsel, get people around you, really examine what is it that you need to know. There's so much more information out there now than there was at the beginning. At the beginning, we were just hearing canned statements from a few sources, because nobody really knew what was going on until it unraveled. And then I think we learned a lot more. When Dr. Corey stepped forward and started talking about ivermectin and how well it was working, and Dr. Merrick, And they testified before the Senate Subcommittee on Health, and they made such impassioned presentations. And these were brilliant ICU and pulmonologist physicians who were saving lives. I think to take a step back and really just take a moment and find some peace and actually get some help from somebody who may be helpful. Ask around. That's very non-specific. Wow.
You know what? Epsom salt baths. I'm going to throw that in there.
Oh, that's a good one.
But make sure your Epsom salts, people, are clean. No perfumes and nonsense in it. The cheapest Epsom salts are the best, actually.
Right, with no lavender or
Yeah,
anything
yeah.
like
You don't want any of that
Absolutely,
nonsense in there.
Right. So that's an excellent one, actually. Very good. Elderberry is wonderful too.
Elderberry syrup,
Oh, there are so many other wonderful ones.
honey, garlic, all those kinds of things. Also, when
Exactly.
we got sick in the Tommy household, we had a friend who's a doctor give us a glutathione nebulizer, and I don't know whether that's good or bad, but that's really helped us out.
It helped. So for certain strains, it does help. The other thing that really helps is Pepsid.
I don't know what that is.
So Pepsid is an antihistamine. Dr. Dietrich Klinghardt was sharing that information in December of 2021, and he was saying take Pepsid as an antihistamine because it will stop all of the congestion in the sinuses. Benadryl was working. Zyrtec was working. And so these are over-the-counter medications, and so these things can actually be helpful as well.
Well, so now just to remind everyone, we are definitely not giving out medical advice. We're having a little chit
That's
chat
right.
on things that have helped us in our lives.
Absolutely.
Take what you want from it. It's definitely not the views of children's health defence and all that blah.
Exactly.
And your clinic here. So as we're time's up, but just what's your one last thing you want to tell the world as we approach the fall and winter?
Be ready. Just be prepared. Have everything that you need on hand, whether it's a nebulizer, whether it's elderberry, whether it's honey, whether it's vitamin D, vitamin C, any of these things. Hydroxychloroquine, ivermectin, hydrogen peroxide, povidone iodine to do the cleansing of the sinuses and things like that. Epsom salts. Just have some basic things on hand. Even baking soda with pink Himalayan salt, a bath, will help draw the toxins.
That's interesting. And I think this winter they're definitely going to push this RSV. The babies are going to be the target, and those parents, you're going to be in so much fear with all the crazy stuff on TV and stuff.
That's right.
So please be careful, because I think we're going to hear a lot of terrible
Absolutely.
baby toddler stories this
Look
winter.
alternatively, because there are a lot of us out there. Look alternatively and be heard. Make sure you're heard, and don't stop until you're heard.
And don't forget the brilliantness, if there's such a word, of brilliantness of chiropractors.
That's right. They're very helpful.
Very helpful.
Absolutely.
Well, this was fun. And what is your dog called?
Angel.
Okay, Angel, you've been a very good little girl. And
Sweet.
and guys, we've got some more stories coming up.